Person-centered care, CE course. Person-centered care. Introduction to person-centered care. Person-centered describes a certain way of thinking about people, how you treat them. Every individual is equally deserving of your interest, respect, empathy, compassion, and service. Person-centered has like three philosophies. These philosophies are learning about people, valuing people, and supporting people. It's described in this book throughout. The first one is learning about people. So when we take care of people, we need to know the people that we are caring for. So the first one is a commitment to discover. So the very best caregiver will always try to learn more about the people they work with and they care for. And then the second one is discovering the whole person. It's important to learn about your client's physical health needs and the services they receive, but it's equally important to consider their strengths and abilities. Next one is recognizing and respecting worldviews, perspective, and attitudes about the residents or clients. We need to know what are they thinking, how do they view the world, what's their thinking, what's their perspective about life, what's their attitude, what do they think. We need to know. And learning about what's important to and important for are very important. Important too is something you value. It includes things that make you happy, comfortable, fulfilled, and satisfied. Spending time with friends, going shopping, eating your favorite food may be all important to you. Important for are the things that keep you safe, healthy, getting enough exercise, paying bills, drinking lots of water might be an example of things that are important for you. And learning to communicate effectively with people is very important while you are working. So these all are included in learning about people. You also, when you're learning about person-centered care, you also need to know how to value people. Valuing people is seeing the best in clients or residents and appreciating what they have to offer. Accepting them just as they are rather than what they could become. Sometimes we call this unconditional positive regard. You can show someone that you value them with your words and behaviors. Accepting the whole person means accepting their physical capabilities, their personal beliefs, their morals, values, views of the world. When we accept these, we recognize these values and don't try to change these to meet our personal views. Showing respect for people and dignity. Yes, it's over here. Showing respect and dignity for our clients. That's valuing them. In the person first language, there is a video. I will send you an email. It talks about the person first language and identity first language. This is how people view themselves. Example, if somebody has a diabetic, that person can say, I'm a diabetic, so he's identifying himself with the disease. Or that person can say, I have a disease called diabetic, so he put himself first, so that's first, person first. And the second one is identify first. It's kind of identity first and person first, the way people explain their own, that's their value. So also need to have We need to recognize their dignity. A lot of people, they have their own things for a long time. Having control over our own lives is a fundamental human right. This includes making choices that may not be healthiest for us. Keep in mind that as a professional caregiver, you should always promote good health and safety, but you should also honor your client's personal choice and control, but you could tell them what's right and what's wrong. Okay, the next one, and when we are talking about person-centered care, is supporting people. How do we support people? We support people with different conditions, like promoting choice, direction, and control. We promote for the client what do they want, where do they like to go, what do they like. Or we also promote their self-determination, direction, autonomy, and independence. As a caregiver, you support a client's ability to be independent. Each client will need different kind and level of support in their daily life. In some cases, the client will need you to perform the entire task. However, in many cases, you will be providing just as much assistance as they need to complete their tasks. Exercising power with rather than over. And build healthier relationship with clients is valuing them. Tailoring your care is like valuing them. Facilitating teamwork so they can help you and you help them at the same time. And you are always an advocate for the client. Okay, so person-centered care includes three things: learning about people, so we learn them, we value them, and we support them. This is lesson 1. The next one we go to is lesson 2. That's honoring differences. Honoring differences. Before we talk about honoring differences, I like to say, a lot of people have different understanding about people's sexual orientation. Some people are gay, some people are lesbian, some people are queers. Those things, I know it may be not supported by culture, but we as a caregivers, we need to understand what their preference is. There are some terms here, maybe you need to understand: bias, cisgender, creed, culture. It's very important to know these words. Okay. When we know about honoring differences, we start by understanding cultural appropriate care. When we work with clients, all people are different, they have different cultures. Identify individuality. Each person is a unique and worthwhile individual. Intersectionality and intersectionality is either culture and identities are overlap. Culture self-reflection. Before you can honor and respect client identity and culture, you need to be aware of how your own background and life experience shape your point of view. How do you see? So does your culture affect the care that you're giving? That's the point. Getting to know the client. Get to know each client as a unique individual. Culture, humanity. Providing culturally appropriate care is more than having knowledge about various cultures. Okay, now let's talk about bias. There are some, when we talk about honoring differences, there are some topics that we need to go. The first one is bias. What's a bias? Bias is a natural function our mind that helps us make sense of complicated world. can be positive or negative, either conscious or unconscious. Bias is something, the way we understand, the way that our culture teaches or the environment teaches. Sometimes it's conscious, sometimes it's not unconscious. So the book separated like explicit and implicit. Explicit bias exists when a person is aware of the prejudice and attitudes towards certain groups. Implicit bias is unconscious. We're not aware that we have their biased feelings. We're not aware of it. Like, for example, if an obese person comes, you will say, oh, she's too fat. You don't talk about it. It's you're not aware of it, but you are discriminating that person. But explicit is something that we know. You know this person is a gay, but we discriminate it because we don't like it. These biases negatively affect the care that we are giving. Especially in a long-term care setting, the community, if there is a person that have a different view of the world from the other one, they can be bullied or discriminated. So as much as possible, we need to introduce these biases. So we need to respect sex and gender identity. Sexual orientation and gender identity are key parts of a person's sense of self. The freedom to be ourselves is essential to our quality of life. People who are part of the lesbian, gay, bisexual, transgender, and queer communities may not feel safe to live openly. LGBTQ population and demographics, when you look at it, it's a lot. In 2020, about 5.6% of US adults identified as lesbian, gay, bisexual, transgender, or something other than straight or heterosexuals. Best practice for creating a safe environment is accept the body parts. Do not define a person's gender identity. It doesn't matter what sex somebody has, just respect it as a person. So when we are talking about sexual things, we need to aware of the languages. I mean, most of you know lesbian is woman or woman, gay is like a man with a man, bisexual, both languages, and transgender and queer. It's good to be familiarized. What are these? And we need to honor their gender identity when we call them or when we talk to them. And especially the way we call them, if the person wants to be called he, we need to use the correct pronoun. We call him he. If the person wants to be called she, we need to go by that. Thank you very much.